Hi, I did my presentation on cerebral palsy. I'd like to start off with the definition of cerebral palsy. Cerebral palsy, CP, is the most common motor disorder in children. CP affects the ability to move and maintain posture due to abnormal development or damage to the brain. Next, I'd like to talk about the types of CP, and these are based upon motor function and it affects the movement. The first type of CP is spastic. This is the most common type, and its characteristics are stiff and tight muscle movement. Next is dyskinetic. This is involuntary movement, which is more noticeable when the person tries to walk or move. It can also be slow and continuous movements, and it can also have twisting positions. Next is ataxic. This is the least common types of CP. This is characterized by shaky and jerky movements, instability, and lack of balance. Last is mixed. This can be a combination of any of the types listed above, and the most common type of mixed CP is spastic dyskinetic. CP can also be described based upon the location. It's important to know the difference between paresis and plegia. Plegia is meaning paralyzed, and paresis is more of a weakening. The graphic listed on this slide does a really nice job of describing some types of CP based upon location. Hemi is when one side of the body is affected. Di is all four limbs, but the legs are more affected than the arms. Quad is all four. Mono is just one limb. And tri is three. Next, I'd like to talk about the causes of CP. There are two categories when referring to the causes, and the first one is congenital. This happens during prenatal or perinatal, which is before or during birth. Most of the causes are unknown, but there are many risk factors that can increase the chance of CP. Some risk factors include prematurity, low birth weight, blood clots, infection, and lack of oxygen. The other category is acquired CP, which is postnatal. This means happening after birth. Some causes are infections in the brain, such as meningitis, head injuries or brain injuries, problems with blood flow to the brain. There are also some risk factors, which include blood clotting disorder and some genetic risk factors as well. Next is the prevalence. 1 in every 323 children have cerebral palsy. As the graphic shows, it's higher in males, and it is more common in African Americans. Last, I'd like to talk about the characteristics of cerebral palsy. It's really important to know that no two people that have CP are the same. It can be different in the type of CP, it can be different in the severity, and the characteristics that I'm about to go over are not going to be found in every cerebral palsy case. And of course, the main characteristics of CP has to do with motor and movement, which was discussed in previous slides. So that's the physical aspect. There are some co-occurring disabilities. Epilepsy is very common, which is reoccurring seizures. Autism spectrum disorder can also be a co-occurring disability, as well as intellectual disabilities, which can affect the child's learning. Some have vision or dental problems. Some have hearing loss. and most have speech impairments. And some speech impairments that are fairly common in CP are articulation, apraxia, and dysarthria. Drooling and issues with feeding may also be present in CP. So that is my presentation, and I hope you enjoyed this quick overview of CP.